pandemic. Let's talk now to the Chief Executive of the NHS Confederation, Danny Mortimer, and also to Professor Andrew Hayward, Director of the UCL Institute of Epidemiology and a member of both SAGE and NerveTag. Morning to you both.
Good morning.
Danny Mortimer, it is hospitals that are in charge of this process, at least to start with. How are patients going to be identified, the ones who are at the front of the queue?
As you say, good morning, Nick. As you say, it is hospitals who are at this first phase. Primary care sites and other bigger sites will follow very rapidly in the coming days and weeks. The NHS will make contact with patients to let them know that the vaccine is available to them. We will be targeting this week those patients who are due to attend hospital for outpatient appointments, one of those 50 sites. We'll be targeting patients who are in our beds already, awaiting transfer of care home. And we'll also be in contact with our colleagues in care homes, the employers of care homes, to identify their staff and to bring them in. And finally, please, Nick, please go ahead.
I was going to say the critical thing is they will have to come in. In other words, in this first phase, before the vaccine can be spread to smaller hubs, people have to come to you.
Yes, they do. They do physically have to come to one of the 50 sites. As I've said, the NHS will make contact with people. There's no need to contact your GP. As you indicated, this is the start of a marathon now in terms of scaling up the vaccination programme, and tomorrow is just the first few steps in that marathon. It'll take us many weeks and months to get the vaccine to people, but we will be making contact with you, and also to reassure the public, any vaccines that hospitals don't use this week will be used for their staff who've already been identified as being at high risk. So no vaccines will be wasted, and as I said, we'll be in touch.
No waste, which is good, but critical too is to make sure that people come back for their second jab. Have you got the infrastructure to make sure that happens?
Yes, we have. Huge amount of work in recent days by teams across the NHS, particularly colleagues in pharmacies and IT departments. So we have systems in place that mean you'll be contacted and booked for your follow-up, your second jab, in 3 weeks' time. The jabs have to be given 3 weeks apart, and the systems are in place to make that happen.
Well, let's bring in Professor Hayward now. Those are the knowns, as it were. What are the unknowns about what the impact of this vaccine rollout will be, Professor Hayward?
Well, I think we do know that this is going to make a massive difference, but there are still some unknowns and cause for caution. I think one of the big unknowns, which I think we can be fairly optimistic about, is whether or not the Oxford vaccine will be licensed. And if that happens, then our delivery challenge will be substantially less. We'll be able to get it out to where it's needed much better, because it can be delivered in a more traditional way.
Because there are no worries about getting it to a very low temperature.
Yeah, exactly. I suppose other concerns are we don't really know how long the immunity will last. We know it will last at least 3 months. We know natural immunity.
Oh, we've got a few problems with Professor Hayward's line. Let's go back to Danny Mortimer while we try and re-establish that line. Another concern, I imagine, for those of you in the hospital sector is what impact this has on the other services you're trying to provide as you have to divert staff to dealing with the vaccination programme.
Yes, Nick. Obviously, we're bringing in extra staff. We're training up those staff to be part of the vaccination programme as it expands. But as we've talked about before, NHS teams in hospitals and in other settings as well, community and primary care and elsewhere, are managing COVID, keeping other services going, responding to winter now, which is well and truly upon us, and also some staff are being diverted to help with the vaccination programme. And when the vaccination programme...
We'll just bring Professor Hayward back in, Danny, if you don't mind, because we've managed to re-establish his line there. You were just saying, Professor Hayward, you were telling us about this critical difference between a vaccine that stops us being seriously ill and one that stops the infection spreading.
Yes, and I think that's important. So the strategy at the moment is to vaccinate those people who are at most risk of becoming critically ill. And so we know that the vaccines will do that. And so vaccinating those people will make a big difference to mortality. But if we want to start to impact on reducing the overall levels of the virus, we need a vaccine that can help to also stop shedding of the virus and asymptomatic transmission. And so the proportion of the population that we would need to vaccinate to achieve what's called herd immunity would vary a lot depending on whether or not it prevents asymptomatic shedding of the virus.
Now, that means that everybody said that we've got to carry on with social distancing for a long time. Are you concerned when you see photographs of very crowded high streets and shopping malls that perhaps some people have concluded it's all over?
Well, it's certainly not all over, and yes, I am concerned. We still have the winter to get through, which is likely to be the time that's most favourable for COVID transmission. We could still see very severe peak, particularly I think probably in January is when I would predict that would be most likely if we take our foot off the pedal on this. And that would be so sad, considering we're going to be in a stage where we can protect the most vulnerable during December, January, February, and start, I think, to get much back to normal in late spring, early summer.
Professor Andrew Hayward, Danny Mortimer of the NHS Confederation, thanks for joining us. Confederation, thanks for joining us. Confederation, thanks for joining us. Confederation, thanks for joining us.